In this video today, we're going to talk about anxiety and why it's not a minor diagnosis and what are some new treatments in order to be able to get improvement and how to be able to get back on your feet. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician who helps patients understand how to be able to deal with emotional, mental, and physical pain, how to be able to know their options so they can be able to punch pain in the face and get back to leading the life they deserve. Today, we're talking about anxiety, and we're talking about it like with real, just true sentiment and science. And so what do I mean by that? When we talk about anxiety, people have this feeling sometimes of despair, of really just feeling like there's no hope to be had, right? But when they have and try to broker that conversation with people, sometimes even people they care about, it's met with a whole host of stigma. And those stigmas can be everything from like, why can't you just choose to be happy? Well, everybody has anxiety and depression. It's all in your head. Well, therapies and medications are just scams. You don't need that. You just got to get over it. Other people have a lot worse. And are you doing this for attention? And the fact of the matter is, all that is malarkey. There are some serious side effects and issues that are associated with anxiety. And I want to talk about that in this video so that you can feel not only validated, but you also can be armed with knowing that there's reasons and rationales for why you need to be able to look for treatment. Anxiety itself can present with a number of different symptoms, including the following. It can have restlessness that's associated with it. You can be irritable. You can have fatigue. You can have shortness of breath. You can have heart palpitations. You can have difficulty concentrating, muscle tension, and headaches. And the fact of the matter is, this is not an uncommon problem, right? People think it's uncommon, but it's truly not that's the case. Somewhere between 25 and 33% of Americans have an anxiety disorder at some point during their lives. And when we talk about this, it's not just a temporary worry or fear. It's anxiety is a disorder that does not go away, and it can get worse over time. And in feeling that, patients need to understand, people need to understand that it's certainly more common than what's expected, and its treatment is really many times missed. So when we look at this, 20% to 30%, as I mentioned before, of Americans are struggling with anxiety. 60% of women traditionally can have some degree of anxiety, and severe cases can be as common as 23%. When we look at this quick graph over here, an infographic, it shows this. So you look at depression, about 11% have minimal to mild symptoms, while anxiety is 21%. 30% are moderate, and 30% are moderate in anxiety. And nearly 50% have severe anxiety of people who have the disease and problem, right? We look at teens, nearly 1 in 4 kids actually have some degree of anxiety. And of that 1 in 4, 25%, 80% are never treated. 80% are never treated. And it's just like, oh, we just get over it. Let's look at a histogram breakdown, and it looks like this. You can see the commonality of it between genders, and you can see the prevalence, particularly in early in life, and what happens with that. So a lot of people say, okay, well, you're just a little bit worried and nervous. No big deal. No, that's not the case. Actually, when you look at anxiety, it has a whole host of different issues that are associated with it. One, you can have chest pain, you can have heart palpitations, shortness of breath, as mentioned earlier. You can have thoughts of worry about everyday life, fear of dying, unwanted thoughts, nightmares, flashbacks, irritability, anger, trouble focusing. It can cause you to change your behavior into rituals that are difficult to be able to control. It can cause you to be easily startled, avoidance of people and places and things. It can limit your life experience. It can cause you to lose your temper more frequently. All those things, right? And people still will say, oh, well, I'm not so sure it's that big a deal. It's just something that you just got to cope with. Well, let's talk about the physiologic components of it. So the physiologic components, as mentioned, it can cause you to have depression. It can cause you to have breathing problems, an upset stomach, loss of libido, extreme fatigue, which is frequently misdiagnosed for myofascial disorder, increases in blood pressure, muscle aches, and pounding heart. Right. And this is not something that is just limited to the person themselves. It has a huge economic impact. When we look at what anxiety can do, the direct cost can be $147.8 billion across the world. 23% is direct cost, and the others are associated with how it affects things downstream, particularly the illnesses associated with it. And so what do I mean with illnesses associated with it? Were treatments that are traditional treatments, things like medications. And so some of the more common medications for anxiety are going to be things like Zoloft, Xanax, Alexa, Lexapro, Wellbutrin, Cymbalta, Klonopin, Ativan, those type of meds, right? And so what does that break down to? It breaks down to predominantly antidepressants like SSRIs and SNRIs, right? So that stands for selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors, as well as anxiety medications like benzodiazepines. So those medicines can be useful and they can be helpful for some people. But also there's other techniques that are out there that we're going to talk about, give or take about 5 or 6 of them today, that may be able to have some degree of value for patients that are suffering from a disease that's not really given a lot of credit and can be hugely influential over how you live your life and how you're able to really be able to be functional. Right. So there's some things out there that are unique and interesting, things like virtual reality, which we've talked about in other videos. But that virtual reality piece has actually expanded greatly in an exponential fashion, where you see things like books that are teaching therapists of how to be able to use VR for desensitization and such. And many people will say, well, VR is kind of like a kid's thing. You just play a video game and blah, 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 blah. Well, yeah, that's not what the science shows. The science shows the following, is that the success rate of being able to improve anxiety and PTSD is somewhere between 66 and 90%. People will say, well, 66% is not all that great. Well, yeah, I can tell you when you talk about comparing it to medications, that certainly can be improvement. And when we talk about how that compares to like physical pain, it actually outpaces it in a lot of different ways. There are other different types of techniques like meditation behavioral modification that does and looks at mindfulness and how to be able to look at letting go, how to be able to improve trust, how to be able to look at acceptance and non-judgment. And there's a whole host of different methodologies of using that. Just not rely upon an intervention or technology, which can be useful. On the other end of the spectrum are things like transcranial magnetic stimulation, which we talked about in depth and detail. Many people would say, oh, well, what's the utility and how well does that work? Well, it's actually pretty darn effective in a lot of different ways. And so when we look at it, what they believe is that there's an element that affects how the brain talks to itself. And there's a positive side of the brain and there's a negative side of the brain. And TMS can be able to improve those positive thoughts. So when you look at kind of the left and right hemispheres, they've been able to associate this with something that's called functional MRI. And functional MRI is a way that assesses how well blood flow is with potential utilization of the brain. And what they've been able to show is that TMS has been able to improve not only GAD symptoms, but they've been able to correlate that to that connectivity and been able to represent that with fMRI studies. There's other things out there like CBD, and has that been able to help anxiety? So the background behind CBD is the following, is that it works on something that's called the endocannabinoid system. So what does that mean? The endocannabinoid system is a system that recently was found within probably the last decade to 15 years. We've known about the neurologic system. We've known about the circulatory system, the pulmonary system. We've known about the endocrine system, which focuses on hormones, things like insulin and glucagon and parathyroid hormone and thyroid hormones and things along those lines. But the endocannabinoid system is a system that exists that's superior to both of those two, and it affects how the nervous system works and how the hormone system works and how to be able to have something that's called homeostasis, meaning bringing the body back to a baseline. And so the endocannabinoid system has its own receptors, which are actually instrumental in being able to provide kind of that stability. And so those are going to be things that CBD and to some extent THC actually function and help regulate. And those are going to be things that impact certain parts of the body by helping modulating stress and anxiety. And these circuits that are present for that are obviously related to behavioral states that influence anxiety. The interesting piece is that endocannabinoid system doesn't work on its own. There's a number of different things that take place, but mainly it works by attaching to a receptor called CB1. And there's a couple of different receptors that are out there, but that helps relay messages to other neurotransmitters that can be able to produce or prevent rather can be able to decrease or prevent anxiety from occurring. Another therapeutic option is the following, is ketamine for refractory anxiety. And so there's a whole host of different methodologies behind how ketamine can work. I think I have a question coming in real quick. That's, do you promote, let's see, is it showing up? Do you promote CBD use? Well, right now, what I'm talking about is mainly different therapeutic options that are in play, but I'll make a quick divergence for the question that comes forth. I think it depends on the person. And one of the things that article just was saying is that the interplay between that system that works, that CBD works on, the endocannabinoid system, and how it impacts the neurotransmitters, as well as kind of that endocrine and paracrine system, is very unique depending upon the person. And it can have something where it is not as robust over a period of time. So it depends on the person and depends on the methodology of what they're utilizing in order to be able to kind of get a responsiveness. So in regards to ketamine, people have thought, oh, ketamine is just a horse tranquilizer or it's an anesthetic. It really doesn't have a multi-varied treatment option. And again, not true. It actually is very unique in how it affects anxiety in a lot of different ways. Specifically, it enhances a number of different things. It works on the NMDA receptor, which changes a number of different things, like increasing glutamate. It can increase something that's called BDNF. It can increase dopamine signaling. And all of these things, in addition to causing increases in how the neural synapses are, can be able to decrease anxiety. When we get into depth and detail, this is what it kind of looks like when you really break down the different effects ketamine can have. It can affect the prefrontal cortex. It can affect areas that are the rostral components of the medulla. It can affect the hippocampus through a number of different mechanisms, which are not simple. So are there other therapies that are a little less invasive? Yeah, there are things like biofeedback and different articles that support that. We've talked about this a number of years or so ago, but to rehash for those people who may not be familiar, biofeedback is where you have someone who sits in front of a screen. They're looking at various different physiologic measures, and those physiologic measures are, in essence, you're looking for a desired physiologic state. And that physiologic state is represented by how well what that person is watching on a screen is present. When it's not present, it actually is indicative of you not being in the appropriate physiologic state. When it is present, it's in a better physiologic state. So the same way as you can use kind of breath to be able to improve anxiety, this can help you be more in tune and have your body be in that better state of anxiolysis, meaning it's not as prevalent and as prominent. One of the other ways is to be able to look at neurofeedback within that same context. As referenced before from TMS, what they did is they looked at quantitative EEGs that looked at how the connectivity of the brain actually works. And that connectivity of the brain is fairly prominent for those who are healthy. You can see this whole green array that you're looking for. And those patients that have anxiety is not as prominent in terms of how the brain talks to itself. But then afterwards, you can see this improved connectivity. Specifically, when they go into this, they talk about this change that's present in the alpha wave. And the alpha wave is a representation of different waveforms that we're trying to isolate for. And by applying an alpha increase and alpha decrease protocols appropriately, you can see a decrease in anxiety disorder. So some pretty interesting, unique ways to be able to provide treatment. There's a few other things that are out there that are kind of still in sort of their initial investigational phases. And I want patients to have an understanding about some of those options too. So there are things out there like transcranial direct current stim. And this is not the same as TMS. It's completely different. They're frequently confused from one another. And many people think that TMS is this shocking sensation, which it's not. It's using magnetic energy to be able to generate those increases in neurotransmitters and other connectivity states. While TDCS is actually using electrical sensation, which is very minimal in nature and is not really all that perceptible, to be able to have different changes that can improve endocrine function, improve stress and cognitive control, and at the end of the day, influence the brain in a positive way. There are other mechanisms like non-invasive vagal stim, which we've alluded to very briefly without being in depth in detail. But non-invasive vagal stim, which can be utilized in a lot of different ways, is a way to be able to use electrical energy to target the vagus nerve. And that vagus nerve has connections to parts of the brain like the cortex, the thalamus, the hippocampus and amygdala. And those things can be able to improve overall overall anxiety. There's other different tools that are out there that may have some utility as well. Things like alpha stem, which in essence is really a cervical stimulation that's in place. They've been showing that there's a fair amount of cost effectiveness, particularly compared to anxiety medications. And there's a couple different papers that have looked at how it's been able to take, if the blue line is that person who has significant anxiety with a number of different problems like hostility and OCD and feelings of pain and depression, and been able to improve things significantly with the red and green lines to see these drops and those scores of things like hostility and pain that's associated with it and depression. And they've shown it in a number of different patients where it's been able to be seen that's repetitive in nature, and it can be, in essence, produced from one patient to the next. So a number of different options that are out there. The commonality of saying that anxiety is just all in your head and there's really nothing that you need to do but get over it. We know, and we've been able to dispel that in this video by showing there's physiologic outcomes, there's mental outcomes, there's behavioral outcomes, none of which are good. There's potential financial issues that are associated with letting anxiety be untreated. And for the most part, anxiety is untreated in a lot of different ways, particularly for young children that grow up to be adults and still have these things that are going on. So what I want you to be able to take away from this video is that, one, that anxiety is real and that it has problems and issues. And two, is that there are options that are more diverse and more prevalent on how to be able to beat it, get over it, in addition to medications or in lieu of medications, so that you can punch pain in the face and get back to leading the life that you deserve. Thank you so much for joining. If you feel like this might be of value for someone else, please share it. And if you're interested in learning more about topics like this, subscribe to our channel. Thank you so much and have a great day.